Today, promoting adolescent reproductive health through participatory community engagement project, which is PASPCE, is a collaboration between Savana Signatures and UNICEF in an endeavor to contribute to ensuring safe communities for young people and adolescents to participate effectively in communities, thereby improving their reproductive health and right choices. The project has been under implementation in 5 regions and 17 districts for the past 2 years and has focused on using key SBC, social and behavior change communication approaches to engage communities, especially gatekeepers, religious and traditional leaders, parents, families, anybody who is in the position of supporting create such safe environments for young people to thrive.
The first meeting that we had to address these issues, we brainstormed and we brought stakeholders on it so that we see how to minimize the social vices that our children are putting in place, which will be a burden on them in their future. So lucky enough, it has yielded a sizable fruit.
Niama besua no be pase me ko fie as chairman na mama ufo nyina so wate se we na yaba besua e na mankasa so aboa me ankasa amama nya inscribe bebre se nya nkwala yentimi hwom no mankasa se nya yentimi hwom no se ya hwa nkwala na kwa nimu a ebeboa.
This kind of training that we are really doing is really very helpful because the children really need such education. Because we realize that they don't really have that training. So if we come in like this, if Savana Signatures and other NGOs, they come in like this to push the information and that training, that agenda, we realize that the children pick it and then they understand.
Niama be suya fi nkwala no ho ni say me hwa me ba so yiye na se me bo no ho ban wo school mu a da chi obeko school no e de fa so abere me na mbo man hwa abofra no so yiye a niame mpe no eno na ode be bere me.
We have implemented the project based on key strategies, as mentioned, key SBC strategies, including the use of CICs, Community Information Centers, and community radios as a means of continuously engaging communities in these conversations. We believe that it is in the continued engagement that behavior, attitudes, perceptions, and all of these things start, becoming. So it was necessary for us to engage the Ghana Health Services Health Promotion units across the 17 districts to engage their communities in these activities.
After teenage pregnancy, it is known everywhere that many of our communities record high numbers of teenage pregnancy. And Tality district is even known in the region to have recorded high numbers of teenage pregnancy in 2021 and that of 2022. But we are collaborating with NGOs like
Savana Signatures,
UNICEF, and others that are helping us give adequate information and education to the communities on how we can all partner one another to reduce this teenage pregnancy in our district.
In fact, our district has been suffering from teenage pregnancy issues over the years. The league table in the region for the past 3-4 years, we were actually leading in teenage pregnancy, which In fact, it's never any good news. Because, as you know, teenagers are the backbone of every society. But unfortunately, some of them actually end up getting pregnant, and you know, their future is shut down. So it has been an issue in the district over the years, and thank God we have some NGOs to actually partner us to fight this very canker. NGO like Savana Signatures has been in the district for some time now. In fact, they do activities such as empower adolescent girls and boys, educate them on sexual and reproductive health issues, and actually make them assertive.
I'm very glad this evening for our health workers to be here today at precisely Bowohoma for a program on a teenage pregnancy. I may first of all say it's a very good program, and then we in Akachi North District, in fact, for the past years, we've been recording the highest number in teenage pregnancy and other stuff. So because of that, I think with this program today, it will help us, more especially our young ones, to be able to achieve their dreams as in a way of preventing themselves from early pregnancy and other STDs.
Teenage pregnancy, elbow would day will papa. Same time, elbow would day one day. You may say a man, what 10 years and in time the door can what do JHS 2. 1 and 2 no. Be one after you from what the
with this community, we are having so many prevailing adolescent health issues, as in teenage pregnancy, we are having abortions and other stuff. But I think the most common one is the teenage pregnancy.
For the past 1 year, since we've been partnering with these NGOs, we've been doing a whole of community engagement as well. Because when you listen to the adolescent, there are certain things that they need to actually get, they are not getting from their parents. That is why sometimes they actually indulge in some of these things. So we had a series of stakeholder engagement, and thank God, things are actually moving positive now. So recently, or last week, we decided that, okay, we can actually think of how to just show videos and empower adolescents, continue to empower them to actually live the full potential of their life.
The vital things I have derived from this video is that I'll make sure I'll focus on my education, because our academic performance is very important. So this girl refused to abort the child. So even if mistakenly I fall into this temptation or situation, me too, I will not abort the child, because I can die, which is very serious and dangerous. So I'll make sure I will not abort the child. I'll give birth and focus on my education and make sure that I will achieve all my aspirations before maybe I will even get into marriage, because I know as a student my focus should be on book, not married things.
Many of the adolescents are just ignorant with this teenage pregnancy and sexual related issues. So with this education, I think it will sensitize them to be away from all those sexually related issues and other stuff.
As a member of the Adolescent Youth Club, I will inform my people to be assertive and bold and say no to sex. They should be bold enough to say no to sex. Yes, this will prevent them from being pregnant.
The vital things I have derived from this program, I am not going to keep it to myself alone. I'll make sure I'll teach my friends, especially the SRH members. I'm going to teach them, my family members, my younger sisters. I am going to teach them so that they will not fall into that situation.
from the data that we reviewed, or the data that we have, it shows that malnutrition is a challenge in the district. We also have rising cases of anemia. So it was important for us to engage the communities on good nutrition, because as we all know, bad nutrition has a lot of negative impacts on human health. That is the more reason why Savana Signatures came on board, and then we partnered with them to engage some of the communities in the district on good nutrition.
And then you made the amame who say in the anibebro why dear and why a nipiano and my ye. And yet you made the anime who says I a young baby or what and when and yet a manipibia. Intended you made the amame suya in Yama bebre a woman say I met to me a way, I mean the way, men who say way dear and yet that's a way with dear and one nipiano. If you need to watch a young fan and more funny, I got it.
Addition, by in fact, addition, maybe who say, I did a boy community, nothing even ya so as it him. Answer, am I who in Yama see as I say, ye di. First night, you knew, says I say, ye do, but then am I who in your name, Habaya as I say, if we say, contumbre, agushi beans near the Kakamino, Habaya as I say, and I Kusiana Dina. And even ama who say anyone say you talk Imianu will just be brave. As I say, your mother here, until I may assume a fair, may assume say, as I say, you did be swat, you did fruit.
I want my head as I say, who say, we seek out Bayinu, Ama, you know, Otomi Yadianpa, nor the man, and me a jay. My bone there, Fis Aberco, my bone there, Yiska. Can me Yiska, we are not a corner, said, you are Ben, but Sabrina said, me Yiskana. My share say. Me yero anu aduane a betumi aboa abofra na pomuden ansa na mekọ baby a makọ.
With regards to the exercise that we had with the community, we as a district think that it will go a long way to help the people in the community, in the sense that it will now empower the people in the community to know what good nutrition is and what they are supposed to take as meal.
Meda apomuden adwuma yefo no ase papa ene won boafo a ene wo ba be dis adwuma yi meda wan ase pa se waka bom na wo de sa nkyerɛkyerɛ te se de man.
We have not only engaged the Ghana Health Service, we also built capacity of the Ghana Education Service, a key institution where children spend most of their times, where children learn a lot from. So it was necessary for the project to also engage at that level for teachers and then school management teams to understand the essence of supporting the creation of that safe school environment where students, pupils will thrive.
My name is Prosper Yaudunyo. I'm the school-based facilitator for gender equity. I'm also the SHEP coordinator. When you say SHEP, it's School Health Education Program. This program has been instituted by Ghana Education Service in collaboration with Ghana Health Service in the first and second cycle institutions to make sure that students are in total health as they embark on their educational activities. And our basic activities is to make sure that we bring institutions that can help educate our children, our students, to know much about their health, most especially their reproductive health.
My name is Azora Eric, a teacher of Fumbisi Senior High School. I am the health teacher of the school. We used to record so many health-related problems with our students, which affect their studies in the school.
Today, we are fortunate to have Savana Signatures, an NGO in collaboration with UNICEF, who gave some little education on reproductive health and also gender-based violence.
But since Savana Signatures and Ghana Health Services came into the school to support us in line with the students, their reproductive health activities and their rights, so that they will be able to have a good lifestyle and improve on their services. We were not recording any of the diseases like syphilis, gonorrhea, and other sexual transmitted diseases, which were very rampant in those days.
When I came to the school, cases of STIs were rampant. The students used to come always complaining of these sexual transmitted diseases. But with the intervention of Ghana Health Service and Savana Signatures last year, because they educated them on the signs and symptoms, the causes, there has been a massive improvement. The attendance has been reduced concerning sexual transmitted diseases.
With this education that they are being taken through, they are able to handle issues that affect their life. It even affects their academic performance and even their psychology, and they are not able to do things the way they are supposed to do as students. So I believe this education will go a long way to help them come out of some of these issues that we are talking about.
Another important strategy we have implemented with support from the Ghana Health Service is to go on school tours to discuss the famed iron folic acid supplements that the Ghana Health Service periodically gives out in schools. We have noted in the past that there have been a lot of misconceptions and then myths around these supplements, as far as people going to say that the Ghana Health Service was distributing family planning methods or pills in schools. These advocacy efforts, together with GHS, supported us to engage parents especially, as well as the awards, that is students and then pupils, to understand the need for these supplements.
Our students, who are mostly adolescents, face a number of challenges, issues relating to their menstrual health. Most of the times they complain of pains during their menses, and when it does happen, it affects their learning outcomes. Oftentimes at the office, issues are reported to us in connection with their menses, and so as management we respond. We get some of their colleagues to assist them and take them to the sick bay.
Since a lot of people are ignorant about it, when you educate them on it, it becomes part of them and they accept it, that it's a phase that they have to go through. So they have to make their mind that when it gets to this phase, these are the things that I can go through. Maybe when I'm ovulating, I can experience some pain or abdominal pain, and when it happens like that, it's normal. But when it is severe, we've made them know when it is severe, they should report to us, because it can be maybe out of infection or stress. So when it happens like that, we talk to them. Maybe due to this, that is why your menses is not coming well, or because of your nutritional level is low, that is why the monthly flow is not coming well. And normally too, we also provide them with IFA, that is the folic acid. We give to them every week to supplement them in their when after menstruation, to help them, and I think it is helping them a lot. With the IFA that we normally give them, it is helping them. With the help of the tutors here, every Wednesday they give them the IFA.
Before the education came, our students had a lot of perceptions about the drugs. They were told it is for family planning, and because of that they will not have children. So they felt reluctant taking the drugs.
Initially, the intake of folic acid in the community was very low.
I've been hearing a whole lot of bad news about the folic acid. People said it's an abortion medicine. People also said when you take it, you have some abdominal pains and so many other things.
But through the partnership with the Savana Signatures, now the intake is very high.
But when you came with your education, it made our work very easy, because they heard a lot of things that the drug will give them, the benefits they will get, and the way people were giving them wrong impressions about the drug. You clear their minds, and then they were now ready to take the drugs.
But after the education on how to use the folic acid, when and how to take it, what to get from it, I got to know that indeed this medicine is really good.
In fact, ever since they introduced this kind of folic acid, the students have been taking it. The rate at which they were complaining about their menstrual issues and difficulties have reduced drastically. And I can confess with all certainty that the introduction of the health and for that matter the folic acid have been so helpful. It has minimized the challenges, the pains that the girls especially were going through. Personally commend the efforts of UNICEF and Savana Signatures for the meritorious work that you are doing, especially with the public education on the use of the folic acid and other aspects of the educational and social life. It has helped me a lot, and I will encourage you to continue.
Also, we have trained 12 youth advocates across these 5 regions that we have supported to implement a variety of social interventions geared at supporting them create awareness on issues that they identify in these communities. These youth advocates also double as youth reporters and are able to engage their colleagues as peer educators just to also influence the reproductive health choices of young people. We have also engaged the Departments of Social Welfare and Community Development because of their role in community in ensuring the safety of all, especially children and then young people. Another critical measure we used in our engagement of young people is our famed Young Voices Forum, which is broadcasted on our Savana TV platform. Savana TV is a social media-based TV program that houses our Young Voices Forum, which was conceptualized by young people and powered by young people on a weekly basis. On the platform, young people also engaged with authority on these issues that affect their reproductive health and limit their participation in engagement that affect their lives. We have created a voice for young people and are empowering them to take up that space to let their voices be heard about issues that concern their lives.
Good afternoon and a warm welcome to yet another captivating episode of the Young Voices Forum. This show is proudly brought to you by Savana Signatures with support from UNICEF Ghana. Today, we are embarking on a thought-provoking probe of a sensitive topic, prostitution.
Yeah, I think there's a distinction, but people don't know that there's a distinction. That's why people think that hookup is necessarily doing prostitution. So hookup is just like I go to a club, I meet a guy, like I'm interested in him, we just kind of like have that one night.
Briefly, tell us why the name Upcyclers.
So the name Upcyclers was basically picked out from application as well recycling.
To bring all of these interventions together as one, we have been linking young people and adolescents across these 5 regions and 17 districts we've been implementing the project in to the Ago She Plus helplines. Ago She Plus are helplines that inform, counsel, and then refer young people to appropriate quarters for them to get further services regarding their reproductive health. AGO is an interactive voice response system, whilst the She Plus is a helpline that houses health workers who engage young people over the phone throughout Mondays to Saturdays. You can reach us on AGO on 5100 and on She Plus on 0800 001122. Between 2021 and now, we have successfully engaged 45,000 people in our face-to-face engagement together with the Ghana Health Services Health Promotion Units across the 17 districts of implementation. These have been community engagements discussing a variety of topics, including 4-star diets, including sexual and gender-based violence, including teenage pregnancy, and how all of these affect the lives of young people. Also, we have reached about 2 million people through our CIC, the Community Information Centers and Community Radio approach, where we engaged communities in the comfort of their homes in discussions relating to creating safe environments for children, for young people, for adolescents to make healthy decisions around their reproductive health. Lastly, for the She Plus helpline, we have engaged about 5,200 callers through the helpline, where we have supported them with information, we have counseled them, and we have referred them to the right institutions for them to get the needed support. Remember, AGO and She Plus are free. Once again, you can get us on 5100 and then on 0800 001122. UNICEF has been of great help to Savana Signatures in our quest to ensure positive change amongst adolescents, youth, and vulnerable groups. We could not have achieved this feat without the partnership with UNICEF. Let me also extend a hand of gratitude to the other UNICEF partners that we have been working with across the district to say that thank you for the partnerships. Local partnerships indeed work. Ghanaian young people and adolescents are reaping the benefits of us coming together to support their growth.
For giving me this opportunity to be part of this program. I promise to extend this lesson to my colleagues who are in school and out of school who didn't get the opportunity to be part of us.
For this opportunity, I want to thank the Ghana Health Service, Ghana Education Service,
especially the Ghana Health Service, Ghana Education Service, and Savana Signatures for giving me this advantage and even educating us on this program.
I want to say a very big thank you to UNICEF and then Savana Signatures, in fact, for this initiative, and it is my hope that it will continue.